We're keeping this a zero fluff sprint. We'll hit the classification, run through management, drop a key clinical pearl, expose some classic exam traps, and finish up with a quick recall question to lock it all in.
All right, Section 1, Classification. Let's look at the absolute rules for the Milan criteria.
So, to actually be considered within the Milan criteria, a patient has to fit perfectly into one of two very strict buckets when it comes to size and quantity. Either they have a single tumor that's less than or equal to 5 centimeters, or they can have up to 3 tumors, but, and this is a big but, each individual tumor has to be less than or equal to 3 centimeters.
But listen, hitting those size limits, it means absolutely nothing if absolute contraindications are in play. The patient must have 0 macrovascular invasion and absolutely 0 extrahepatic spread or metastases. If you spot either of these creeping into a case vignette, boom, they are immediately disqualified.
So if you want the ultimate memory trick, burn this specific number combo into your retinas right now. 1 times 5 or 3 times 3. That's literally the whole shebang. Keep that front of mind as we move forward.
Moving on to Section 2, Management and the Clinical Pathway.
Now, you might be wondering, why do these exact, super specific numbers matter so much on the wards? Well, because the management pathway here is incredibly straightforward. Step 1, you confirm the patient is within the Milan criteria, and doing that instantly unlocks Step 2. Liver transplantation can actually be considered, assuming, they're otherwise medically suitable. These criteria are literally the ultimate gateway.
And unlocking that gateway is a massive deal. Why? Because transplantation is basically the holy grail for these patients. It provides a really unique dual treatment benefit. Think about it, you aren't just taking out the tumor. You're simultaneously replacing the underlying cirrhotic liver that created the toxic environment for the cancer in the first place.
Of course, for patients who don't hit the criteria right off the bat, there are other clinical options depending on their specific situation, stuff like resection, ablation, or local regional therapy. But here's a really cool clinical caveat. If a patient is just beyond the criteria, there's the potential for downstaging them using that local regional treatment. If you can successfully shrink those tumors back to within the accepted numbers, transplant might actually be back on the table. Pretty amazing, right?
Okay, on to Section 3, our key clinical pearl. If you only remember one thing from this explainer, make it this. The classic Milan criteria is literally one of the most frequently tested numerical criteria in all of hepatobiliary surgery. I'm not kidding, board examiners absolutely love testing these exact numbers. You are, for sure, going to see this on your exam.
Which brings us right to Section 4, Classic Exam Traps. Because they love this topic so much, let's expose the exact tricks test makers use to trip you up.
Trap number 1, confusing the classic Milan criteria with the UCSF criteria. The UCSF criteria are a lot more expanded. They allow a single tumor up to 6.5 centimeters or up to 3 tumors where the largest is 4.5 centimeters with a total tumor diameter maxing out at 8 centimeters. Do not let them catch you slipping here. Never confuse these two sets of numbers. Keep your focus locked on those stricter Milan rules.
And trap number 2 is all about that macrovascular invasion. An examiner will give you a tumor that falls beautifully within the size limits, right? But then they'll sneak in that vascular invasion is present. Boom, instantly disqualified. Remember, size is only half the battle. Do not let a perfectly sized 2-centimeter tumor distract you from reading the rest of the patient vignette.
All right, let's wrap this up with Section 5, quick recall. Time to test the knowledge we just absorbed.
So picture this case. You've got a patient with HCC. They have 3 lesions. The largest lesion is exactly 3 centimeters. There's no macrovascular invasion and no extrahepatic spread. Take a brief mental beat. Are they within the Milan criteria?
The answer is yes. Huge congrats if you nailed that and applied the 3x3 and no invasion rule. They have up to 3 lesions, each is 3 centimeters or less, and absolutely no contraindications. They fit perfectly.
Before we go, I want to leave you with something to ponder. How do stringent selection criteria like these ultimately save both lives and organs in the incredibly high-stakes world of transplant surgery? Because, it's really not just about passing a test. It's about ensuring that incredibly scarce resources go to the patients who will have the best, most life-changing outcomes. Keep that broader impact in mind as you hit the books. Stay focused, and we'll see you in the next explainer.